Jackson County Public Health is investigating a COVID-19 outbreak associated with Harry and David. Public Health began investigating this potential outbreak on June 17th. Now, as of right now, only 5 cases have been linked to that outbreak, and this is an ongoing investigation.
Meanwhile, Jackson County is experiencing an increase in COVID-19 cases. That increase during the past week coincides with regional increases in COVID-19 hospitalizations.
Today, OHA set an 80% vaccination rate goal for minorities in an attempt to close the medical equity gap. Right now, Jackson County has a 54% vaccination rate for people 18 years and older. Joining us now to discuss local virus trends is Dr. Jim Shames with Jackson County Public Health. Thank you for joining us.
I'm glad to be here. Thank you.
So when we're talking about these new cases our county is seeing, are you seeing those cases tied to a specific outbreak or an event?
No, really nothing specific. I mean, I'm sure that people getting together on the 4th of July might have caused some of it, but really this is a trend where the pandemic continues in the unvaccinated. And frankly, because of the Delta virus, it probably is even more transmissible now in that group. So anywhere you find large numbers of people who are not yet vaccinated, you're going to see significant amounts of the disease.
When we talk about vaccine hesitancy, that's kind of a term we've heard a lot. What are the reasons you're seeing here in our area for people to be hesitant to get vaccinated?
Well, there's lots of reasons. Personally, I think most of them, are not scientifically sound, but we want to focus on the people that really need information to make wise choices, and we want to do all we can to do that. And then there's others that are disadvantaged in the ability to get vaccinated. They have multiple jobs, they got kids at home, they live remotely, they don't have transportation, they're concerned about paying for the vaccines even though they're free. So we want to focus on those that need information and those that need that little extra help to get vaccinated.
Now, I know the county partnered with FEMA. We had that long-term expo event with vaccinations. You guys were doing outreach to bring vans with supplies to communities that might otherwise not have access to vaccinations. What else is the county doing trying to reach those communities you're just talking about?
Right. So we've shifted from this mass vaccination model to a distributive model. We want to make sure that the vaccine is accessible where people go to get their health care, where large numbers of folks congregate. We still have outreach into the Latinx community, for example, at La Placita on Sundays, and we are trying to get vaccine to wherever folks are, including in their own homes. So that's an ongoing effort, and we will continue. That's certainly our plan, to continue to provide those services.
Dr. Jim Shames, Jackson County Public Health, thank you so much for your time. We do appreciate it.
Oh, thank you.